and then it's contraindicated for you, you going to the pharmacy, first of all, you need to be informed. I'm asthmatic. I know that this is contraindicated for me. And then the person dealing the medication out to you should also be able to ask certain questions to find out to get a clear understanding of what is going on. Because if the person gives you wrong medication that's contraindicated for you, it can actually cause more harm than good, like we are all saying over here.
All right, thank you very much. Can you briefly list out maybe some of the benefits that have been linked to appropriate self-medication? Let me put it like that, because for me, what I've seen is it gives you an easy access of relief. You understand? You have a headache, before you even present to the hospital, you take maybe paracetamol or diclofenac, and then the headache subsides. You can later present to the hospital. So I know one of the benefits, it gives you quick relief. Can you give out any more benefits for? Yes,
certainly. Well, as you said, it gives you quick relief. The second thing is that it saves you time.
Yes.
The stress of being in line. You know, right now with our health setting, there's a lot of pressure on our health facilities.
Yes.
So then it will be easier for all of us, and then for you as well, to be informed of what is actually going on. Because I'm tired, and then you go to the pharmacy, you talk about the issue with the pharmacist, you both agree that this is most likely the case, you get the medication and you're okay. The second thing is that once you've done that, it also saves you the time. Like my experience, most people don't do that because they don't see the need to. Yes, because some people have issues. Maybe without taking medications, it just resolves. So they just feel like, well, it wasn't a problem after all. But then what you might not know is that once it resolves, there's probably something deeper going on that at the end of the day would manifest into something much worse. So it's very common for people with hypertension, people with diabetes, these chronic illnesses. Once the first signs start popping up, and you don't do much about it, and then it goes away, you feel like, fine, it wasn't a problem after all, thank God. But then as time goes on, it starts becoming worse and worse and worse, and it gets to a point where it's very, very hard to manage or to be in control. Yes. So that's the main concern for me.
All right. Yes. Okay. So we've been talking to Dr. Markin. Now we are going to find out how the public opinion has been on over-the-counter medications. I mean, before we even started, you heard a little bit on how the public thinks about over-the-counter medications and why some of them don't even go to the hospital in the first place. So, Dr. Markin, what do you think the public education on over-the-counter medication has been so far? Do you think they have enough information based on what you've heard, or you think there's more work to be done?
Okay, all right. So, well, first of all, thank you again. Currently, public education concerning self-medication is poor. There's a lot more work to be done. From the interviews that were done, it seems to me that people feel that going to the drugstore, as they put it, when they go there, they have access to all of their healthcare needs, which isn't the case. Like we already mentioned, the pharmacy serves OTC medications, and then there are medications that are sold without a need for a prescription. But then in their minds, self-medication also involves the use of prescription medication, so which you need a prescription for, but then most of the time they don't have. So that becomes a big problem, because if you're not really conversant with the issue of self-medication, you tend to abuse it, and that is the big problem that we have concerning that.
Okay, so this lady we heard who was saying that, for her, if she has a headache or abdominal pain, it's strictly pharmacy or drugstore, but then when she has an issue with her eye, then she'll go to the hospital. What can you say to this lady?
Yes, so I mean, it's understandable, because the perception is that if I have a headache, it's common. It's not something that is a big deal. I have something with my eye, it doesn't really happen all the time, so it's strange. So that one needs more attention. So that's it. I mean, if you think about it, it's common sense. But then, like we are saying, it's not always the case. Chances are
it's worse than you say.
It's worse than it actually already is.
Yeah.
So then, my advice to whoever or to the lady would be, first of all, when you go to the pharmacy, seek professional opinion. Speak to a pharmacist. If you have access to a doctor, speak to a doctor. Just explain what you have, what has been happening to you over the last period, or over the preceding days prior to what you're experiencing now, so the person can give you an informed opinion. If it's something that you would need to go to the hospital for, certainly you would have to go. If it's something that it can be solved in the pharmacy, it should be solved. The second thing is that people are afraid of going to the hospital because they are afraid they'll spend a lot more money.
Yes.
It's to go and pay consultation for a doctor, to go and pay for labs, to go to the pharmacy to pay for medication again. So it's like they feel like the shortcut would be just go to the pharmacy and then get all of your health needs there, which most of the time will not be the case, because the pharmacist there is not trained to be an all-rounder for your health needs. You understand? So then yes, it's a big problem on that end.
In this era of evidence-based medicine, where it is advised, you do a test, you find out the evidence, like this actually what is wrong with the patient, or the test results point you to something that's wrong with the patient before you give medication. In this era of that, do you think it's contradicting the concept of self-medication, or is just, let's say, an adjunct, or the self-medication is an adjunct? So which is which?
Evidence-based medicine, in my professional experience, is the best way to go.
Yes.
Self-medication, like I said, is the concept that is being misinterpreted. Self-medication is only meant for first aid treatment, but then in actual sense, with everything that is to be given to you, there needs to be evidence to back it.
Yes.
If you don't do that, you end up spending more. It doesn't make sense, but let me try and explain. If someone comes with an infection, maybe has been coughing for a very long time, has an infection in the lungs, and then goes to the pharmacy. You go to the pharmacy with your complaints. The pharmacist, in his professional experience, would say, okay, you have pneumonia. I'll give you this antibiotic and then this painkiller or this cough syrup, and then you take it. You go and then nothing works. Then you have to come back to the pharmacy again, and now the pharmacist will say, okay, go to the hospital. Now you go to the hospital, they run the appropriate labs, they find out what medication would be the best for you, and then you take it, and now the medication goes. What has happened is that you paid in the pharmacy, you paid for medication for the first time, it didn't work, and then from there you went to the hospital, you paid again, and now it worked. That means that you wasted money the first time, essentially. Exactly. But meanwhile, you could have just gone to the pharmacy street, the hospital straight away, done the labs, taking the right medication, and then that was the end of it. So then, if you don't appreciate evidence-based approach, you would end up losing a lot more money than you think you had. So then, that's the thing. Most people don't think about it that way, but they just feel like if I go to the pharmacy, I mean, it's better than going to the hospital. But then, in actual sense, it is not. Okay, it's not.
I mean, when I think about it, I feel there's an underlying cause for every symptom that manifests. So if you're having a headache, there's obviously an underlying cause. If you have an abdominal pain, there's obviously an underlying cause. So I agree with you on the evidence-based medicine. I mean, you can take the over-the-counter medication, and for the moment your symptoms are relieved, so you feel you are okay. But don't just stop there. If you get the time, go for regular checks. Just like I always tell my patients, go for regular checks, because that will tell you, oh, you are healthy, you are not healthy. At least you have the evidence that you are okay. All right. So the public education, you are saying that you don't think the education has been enough yet. What is your idea concerning the herbal preparations that we hear of these days. I mean, when you take a public transport, there's like 15 minutes at the beginning of your journey, there's like 15 minutes of a sermon on herbal medication, you know, how this tea can heal all diseases. I can share with you an encounter I had on the bus once. This guy was talking about the herbal preparation, that it's, after telling us all the things it can do, he now said it's not good for pregnant women. And then he goes ahead to say that about when a pregnant woman is in labor and then the baby is not coming out, the person can take the medication. And then I raise my head and I go like, wait, the person who is delivering is still not pregnant? And then everybody tends to look at me as if I've said something wrong. But then it goes to show that it is really not every medication that can heal all diseases. Because, I mean, this man was obviously contradicting himself. But then in the end, people were still buying the medication despite the question I raised. So it means they didn't really see the importance of my question. So what do you have to say concerning this herbal preparation, the fact that they heal all diseases?
Okay, so, well, first of all, I think everyone should just know that there's no medication that can heal every single disease.
Of course.
That's not how it works. So the thing, herbal medications, they are good, but then there's always the catch. It's good only if there's evidence that it works. That's the most important thing. If you are telling me that this medication can help with whatever I'm going through, there should be evidence to show that yes, this is the case.
Yes.
Because that is what the medications in the pharmacy, that's what they do. If they come out with the medication, they give you evidence to show that yes, I'm saying that this medication helps with your pain.
Yes, they've been clinical trials.
Exactly.
Yes.
So then it is tried and tested.
Yes.
If you come to me with herbal medication, there has to be trials and tests, and that's what most of the herbal preparations here aren't going through. They are only selling it based off of testimonies. So that's basically what it's about.
Yes.
When you go to when you're in the bus, you are listening to these stories, you'll just say, I knew a man, he was here, he had low sperm count, he had back pain, it was never going. But then I told him, try this. And then 3 days later, he came to thank me and he gave me 5,000 Ghana cedis. Like, it's all based on testimonies.
Yes.
But then there's never trials, there's never tests. And that's the reason why, as a professional, I would not recommend that take this herbal preparation whilst I know nothing of the tests and the trials that has been to.
Yes.
I will only feel confident in my professional capacity if I know that there's evidence backing it, and I know that and me knowing that I can have the confidence to say, take this, it will help you.
I mean, the reason why they do all these trials and tests is so that they can also tell you, if you take this medication, there are side effects, this is how to go about it. But then these herbal preparations, I've never heard of any herbal preparation that somebody will say, oh, expect this side effect and then this is how to go about it. Most times it's just, it solves this issue and then that's it. Yes. So
I would like to add, most people don't know that majority of the medications that are in the pharmacy are taken from herbal or herbs.
Yes,
For example, 𝐒𝐞𝐥𝐟, I think the most popular anti-malarial we know, is actually from a herb. The thing is that that particular chemical has been extracted from the herb. That's maybe what, like, it has been extracted from the herb, has been singled out as this is what would help with the malaria, and then we have put it in the tablets for you. Yes, most people don't appreciate that most of the medications we have right now are actually from herbs. The difference between the herbal products and these drugs is trials and then tests.
Yes,
that's the only difference between the two.
Yes, and if I'm not wrong, I believe that most of these herbs, the concentrations are done in such a way that it will not affect other body functions. Because I've had incidents where patients came to me, they took this particular herbal preparation, and then they come with their kidneys failing because the concentration of the medications they took were absurd.
Yes.
So I believe that if the public is really educated on where over-the-counter medications are from, herbs just like what they want to take, but then these concentrations have been tailor-made to be body-friendly, I believe that most of them will understand why they have to go to the hospital, why they have to go to the pharmacy for the actual medications.
You're absolutely right. You're absolutely right. The thing is that most of these herbal preparations, like you said, because of the high concentrations, it causes a huge burden on your kidneys and
liver.
on your liver.
Yeah.
And then you would realize that most of the issues that are relating to herbal medication come with kidney problems and the liver problems because of this same issue. So yes, you are definitely right on that.
All right. Coming back to the harmful effects of self-medication and all of that, we find out that most mothers, I mean, I have a personal experience, most mothers come to me with their children very sick, and you ask them, so what have you given to the child? And they go like, oh, Mito, this medication, and then I bought antibiotics. And most times I'm like, why is antibiotic part of your first line medications? And they go like, oh, Nancy, onya cough, dear, bacteria, now I talk antibiotics I want. So, Dr. Marking, I've heard a lot of things about antibiotic resistance. Can you share a little on that for us?
Okay. All right.
Okay, so first of all, just explain what they mean by antibiotic resistance, and then you can go ahead and explain.
Okay. Well, let me just say, before I get into what antimicrobial resistance is, let me just say that it's a very big problem, especially in today's world. If you look at the biggest issues we have globally, aside climate change, antimicrobial resistance is the next biggest thing. If something like this continues, certain things we feel are very, very simple, very, very hard for us later on down the line. I think that if I explain it, maybe you appreciate it more. But then the simplest explanation I would give for antimicrobial resistance is like, well, the word implies it. It's where microorganisms, or the microorganisms that cause diseases, are now resistant to medications used to fight against it. So to the microorganism, it's like a once bitten, twice shy kind of thing. So maybe let me just give an example. We know that in the past, we're treating malaria with quinine. So it's like whenever someone had malaria, you can give quinine and then the person will recover. But then in the mind of the antimicrobial, it's like every time I'm trying to cause harm to this person, you put quinine in the body and you kill me. Okay, now I'm going to fight back. I'm going to change myself in a way that quinine no longer work on me. And then once that happens, quinine will no longer be effective against malaria. So that's just the basic concept of it. It's like the organisms adapt when you are giving them, when you are using the treatment on it, and over time you realize that the treatment becomes less effective. It's the same thing for sexually transmitted infections of late. Most people that have sexually transmitted infections, common ones like gonorrhea, will realize that once the first time you came, we gave you this antibiotic for the gonorrhea and went. You have it again, by giving you the same antibiotic, but then it's not working now. The reason is antimicrobial resistance. So going back to what I said, that if you don't take care, things we feel are very simple now will be very, very difficult in the future. I was referring to this. If you have a disease condition now, like gonorrhea, and then I'm giving you an antibiotic, it's not working, that means that essentially we cannot treat gonorrhea anymore. And you can imagine how much of a problem that can be. So there'll be more deaths, there'll be more casualties, and things like that. So then that's basically what antimicrobial resistance is all about. I mean, in a nutshell, there are a lot more sectors around it. It's not just with human beings, but then we give medications to animals, and then that's the antimicrobial resistance in the animals can be transferred over to us actually, because we eat chicken, we eat meat, and all of those things. So there are a lot of areas concerning antimicrobial resistance that needs a lot of education about, but then in general, that's just a small aspect of what.
Yes, I mean, even with me in practice, I've realized that a lot of cases of urinary tract infections, the antibiotics we used to give before, when we do a culture and sensitive, they come back resistant, and now it's like the most expensive antibiotics are the only ones that can fight that particular kind of bacteria that's causing the infection. So I think I really understand you. Can you please share a little bit of experiences from home or from the pharmacy where you've encountered someone maybe either overdosed on over-the-counter medication, or the person came back to show you a wrong medication from another pharmacy or another drugstore? Do you have any experiences of such?
Well, concerning antibiotics, I have a lot. The what happens most of the time is that people want antibiotics in the pharmacy without a prescription.
Yes.
And unfortunately, most pharmacies, well, some pharmacies give out these antibiotics without prescriptions.
Okay, so not to cut you short, but ideally, that means if I want an antibiotic, I have to come with a prescription.
Precisely.
So antibiotics are not the routine over-the-counter medications?
Not at all. It's actually unlawful for you to give out an antibiotic without a prescription.
Okay.
Yes, in the eyes of the agencies that look after how we use medications in the country, it's against the law. There are certain exceptions, but then those are for extraordinary circumstances.
Okay.
But then most of the time, antibiotics are not meant to be treated as over-the-counter medications.
Yes.
Not in the list at all. It's a no. Because if we do that, it contributes to antimicrobial resistance. Because once people find out that you can easily go to the pharmacy and a request for antibiotics to be given to you, they tend to abuse it. And that abuse is what contributes more and more and more to antimicrobial resistance. And then for posterity's sake, it's going to affect us all.
Yes.
So for everyone, you should know that once you're abusing antibiotics, you're not doing it for you are not just affecting yourself. You're affecting your family, you're affecting every single person around you. You're affecting your parents, people that are very susceptible to infections, old aged individuals and the like,
the children,
and children most especially. Yes.
I was thinking of an experience I had in the hospital once, where a patient came and then she was telling me she had a flu, and then she went to buy a cough syrup. I think I remember coming to tell you even at the pharmacy that she said she got a cough syrup, and then a big bottle of cough syrup. She finished it in 2 days, and she was happily telling me she thinks she overdosed on the medication, and I'm like, she doesn't even see how serious that is. I think most people believe that, oh, how serious your symptoms are is how much medication you have to take. But they don't get that every medication has a set amount you have to take per time. So what do you have to say to the public about that?
Yeah, so again, you have to be informed. You have to be informed. It's all about education, because most people don't know what is good for them. It's sad to say, but that's the truth.
Yeah.
Especially if they don't have the technical insight into those kind of things. Because we are medical professionals, we know the dangers with overdose. We know the dangers with abusing medication, but then most people don't see it that way. I know for a fact there are some people that they feel if they take the medications more frequently than they should, they would experience relief faster.
Yes.
I've had issues where instead of taking 1 tablet twice daily, they voluntarily take 2 tablets twice daily because they feel like if I take it like that, the problem will be solved faster. But then that's not the case. That's why it's very important. Just follow the instruction. It's what is good for you. It's what we are trained for, and it's what that's why we are here to help you out.
I mean, sometimes I'm just dumbfounded at some of the things some patients say that, oh, I'm a for para. Like when I take para, it doesn't work for me. If I take 2 tablets, which is the 1 gram, it doesn't work for me. I have to take 6. how are you okay taking 6 tablets of paracetamol and you don't feel like you're overdosing on the medication? Do you understand?
Yes.
Sometimes I don't even know what to say to them in
Yes,
response.
yes. You see, it's just the perception, because if they've taken 6 paracetamol tablets and they are alive,
I mean, you are right.
that's
yes,
happening
yes,
to them.
yes, yes, you are right. I mean,
it's very important for them to know that medications can kill, but then it's just a matter of time. You can be taking 6 tablets of paracetamol, but you know that years along the line, you find yourself in a hospital bed with liver failure, and you know why. But then it's because of what you were doing. It's because that's the thing. It's consequences. If you are told to do something and you don't do it because you feel like it makes sense that you do it this way, the consequence will lie on you. So then it's all about just being informed, because your health, well, is your wealth. If you are healthy, you are better off. Most people would rather spend most of their hard-earned money on their health.
yes,
Which isn't the best.
Yes, it isn't
So
the
it's
best.
just
yes.
best to just listen to your doctor or listen to your pharmacist,
Yes.
and then just live a good life.
Okay. So before we wrap up, I just want to find out: is it every drugstore that has